almost 1.5 years back I joined, and this I would say this is an amazing platform. It helped me to understand my finances, my clinic management, how to manage the staff, how to manage the clinic equipments. And as a doctor, I would always say that
Hello friends, welcome to another episode of Hall of Fame interviews. And today we have the young dynamic dentist, Dr. Amit Patil. He is a well-renowned dentist in Goa, and he has 2 centers, and he has grown very well in the last few years. And he is also a proud member of Doctorpreneur Academy. And today we select him as a Hall of Fame.
thank you, doctor. Thank you.
Educational background and family background थोड़ा बताओ तो मैं
Hi, good afternoon. Myself, Dr. Amit Patil. I did my MDS from JSS University, Mysore. Before that, I did my schooling and everything from Kelly Institute at Belgaum, and then joined BDS in the year 2003 at Rajiv Gandhi Institute of Health Sciences, Bangalore. After completing my BDS, I joined BDS in JSS University, Mysore. I did MDS in maxillofacial prosthodontics, implant surgery, and smile design.
So you are practicing cosmetic dentistry?
Yes, I'm practicing cosmetic dentistry in Goa. 2 clinics. One clinic is in Alto Porvorim and in Mapsa. Me and my wife, we both did MDS, and then we started our own practice here in Goa itself. And my wife, she's also a prosthodontist.
Okay. So, बताओ आपकी journey शुरू कैसे हुई? How did you start? How did you go into dentistry, and what all made you do the MDS?
Yes, since my childhood, I was going to a dentist with my dad. I used to go with him. Then that inspired me to become a dentist. I used to see my family dentist when I was a kid. I used to see him working with a very artistic one. And my dad, he didn't have few of the teeth because he was a kabaddi player and he broke his teeth during playing.
Okay.
And that's the reason often he used to visit my family dentist.
Okay.
That inspired me to become a dentist. And before joining my BDS, after joining, I always asked my family dentist about what to do in future. I took his guidance, and this is how I'm into dentistry now.
So you studied from Belgaum, Karnataka. So
Yes.
how did you choose Goa as a center to settle down?
Yes, after completing my MDS in JSS University, Mysore, I was searching for a job. Then my father one day he saw in a newspaper ad that there is a opening in ECHS Polyclinic, that is ex-serviceman contributory health scheme, which is that polyclinic is related to defense. So there is a opening. So I applied it, and I was the only MDS dentist who had applied. All other BDS people had come. They had chosen me as a MDS dentist, and I worked there for 5 years. And then I started my own clinic after 5 years. Now I have 2 clinics in Goa. One is in Alto Porvorim and one is in Mapsa.
And your wife is also a dentist, right?
Yes, my wife, Dr. Janvi, she's also a prosthodontist and she's also a member of Doctorpreneur Academy.
Great.
And yes, yeah, she also practices me in Porvorim, and we have 4 dentist staff working with us.
How did you build this? Well, when you started first, it must be a little doubt in your mind, chalega, nahi chalega, kaisa chalega. So what was the state then, and what was your learning experience during the building of these 2 units?
Yes, initially we started with 1 clinic, and initially, of course, everyone has a struggling phase of waiting period of 2 years. But due to the connection here and due to my professional skills, even though the waiting period was there, I didn't feel much of a hassle related to money because me and my wife, we both were practicing. And then now we are in such a this thing that every day we don't get time for ourselves. Every day we are busy morning till evening with the patients. And as a MDS, we got a good response from the patient, and patients also got the good care.
So you have a good problem to have.
Yes, yes,
Busy doctor is a good problem to have.
yes, correct.
Great, great. So tell me about, I mean, these are the audience who are trying to open their dental setup. So how did you mentally prepare and educate yourself कि अब इतना जरूरत है या फिर whatever is required for the market?
Yes, initially, my advice is for the younger dentist who will be coming. Initially, you should not invest too much into it. Whatever is needed, mainly the dental chair, compressor, suction unit, sterilization unit, then the small equipments. This is more than enough initially. Then slowly you can build up. Now I have two intraoral scanners, which are the top notch of the technology. The three shapes intraoral scanner, and also eye scan, which is these are the two scanners I use. And within few months, we'll be installing CVCT unit at the clinic itself. So initially, you have to start step by step, and definitely one day you will achieve. And I suggest to give the best quality treatment and not to compromise in the cost.
That is a very good message because you should start slowly, step by step. You can go. कहीं कोई भाग नहीं जा रहा है. You can take
Yes,
time and you can properly equip yourself with all the skills and knowledge, and then jump into private practice.
correct.
5 years that you do job. How did it help you?
So when I was working with my ECHS polyclinic, that is with the Ministry of Defense, it gave me a back support. So when I was working at that time only, I started setting up a clinic. Also, I advise you should initially you start with a job where you can learn, also you can earn, and that money you can invest in the clinic, and you can make your own setup.
So what do you do for the competition and the branding?
For the branding and competition, I suggest mostly your skills. The skills are most important. This thing, your
Yeah,
skills and knowledge in the field, that is more than enough to be in the competitive market.
you don't get time nowadays for your personal life and all those. I mean, you cannot spend more time with your wife.
Yes.
This has been, you have found a solution to that.
Yes, nowadays we thought that morning we'll work full fledged till evening 5 o'clock, and after 5 o'clock, little bit we'll slow down with our work so that I can go back home by around 8 o'clock or 9 o'clock. Then I spend a quality time with my son also, because son always he says, even he's a 5 years old, always he says that the time you don't spend much time with me. So now I thought that we'll slow down in the evening with the patient, and we can give the appointment next day and spend the quality time with the wife and the son.
Trying to strike a balance.
Yes.
Next question is like a lot of dentists, other extracurricular work and trying to improve the branding. Do you do anything like as a doctor? It is one thing, but as Amit Patil personality, do you take some seminars or something?
Many a times, me and my wife, we plan to take the seminars. We plan to take the classes for this thing. Many times we plan, but because of our time schedule, we can't give the time. Also,
Yeah.
we have prepared a lot of notes for the younger generation to make it more simplified to understand dentistry, the newer technology to understand. We had made the notes, but we are not getting time. So now we are thinking to open a YouTube channel, and then where we can educate the younger generation with the newer technology and all the newer things.
Social media is the next thing to go.
Social media is the yes, right. You're right, doctor.
When did you join Doctorpreneur Academy?
Almost 1.5 years back I joined, and this I would say this is the amazing platform. It helped me to understand my finances, my clinic management, how to manage the staff, how to manage the clinic equipments. And as a doctor, I would always say that our mathematics is very poor, then finances, we are very poor. So it made us to understand the finances. It made me how to balance your life with a clinical work and the family. And still we are working in. So every day most of the time, whatever seminars conducted, your workshop conducted by the Doctorpreneur Academy, I try to join them and to understand the things better.
I mean, the effort that you do and you utilize the efforts done by us, then there is nothing like that.
Yeah. Thank you so much, Dr. Pranav and Mr. Amit Singh.
So yeah, Dr. Amit, what has been your learnings in starting the 2 clinics that you have opened up?
A lot of learnings. I think that every day is a learning. Mainly, you have to struggle with your staff, getting the new staff, the dentist. So even the Doctorpreneur Academy taught me a few things that which I apply in my life. Is I interview the people prior itself and keep them for the next this thing in case if I find any trouble in the present staff, and then when I interview them prior, it makes me easier to find the next staff.
They offered some internship program also in your clinic?
Yes, a lot of dentists, they come for an internship in my clinic, and slowly, if they are interested, then I convince them to practice here itself. So, but because of that, I got the 4 dentist staff now, 2 here in Porvorim and 2 in Mapsa Clinic.
Great. So, how do you manage 2 clinics?
No, the one clinic which is there, the core clinic which we started first, the full time I dedicate to only the present clinic, and I can say that to my second clinic I had gone 6 months back. So it is all operated on the CCTV and nowadays digital payments.
Okay.
So this is how I take care of both the clinics.
Great. What is your message for the doctors who are starting their practice? How should they build up?
As I mentioned earlier, the doctors who are the younger doctor who are starting their new clinic, as I said, they should start slowly, not to invest too much, because nowadays when you go to any of the conference, any of the clinic, you feel like I want to take each and every material. So not to invest on each and every material, only take the necessity things initially and then start with your clinic.
You should have the must-have things and wait for the good to have.
Yes, yes.
And how important is MDS? I mean, master's degree in dentistry.
See, I would say that each and every person after completing his BDS should go for MDS by seeing all his circumstances, because MDS, it makes you more refined. It not only for yourself, also to the patient will receive a more refined treatment, and you can adapt to the newer technology, newer things. I choose to be a maxillofacial prosthodontics. Prosthodontics is an amazing field in dentistry where you have a lot of things to work. It is not only dentistry, but most of the engineering skills are involved, where we do 3D printing, where we do 3D design with the help of ExoCAD, where we scan the jaw, scan the impression with the help of the scanners. Now we have, when you scan and when you take the CBCT, now you can place the implant robotically also with the help of robotic devices, where the implant placement, the implant position is pre-decided with the help of scanner plus your CBCT.
So you are also practicing cosmetic dentistry, right? So
yes, I'm mainly focusing on implant dentistry and cosmetic dentistry. Yes, doctor.
Some learnings in that part, some things you should take care of.
Yes, cosmetic dentistry is again, it's a wide field where I have most of the clients who are actresses, who present themselves in the front of TV, who are who are very active on social media. So every day we get these patients, and as I said earlier, the skills and the knowledge matters, and the patient look into it, and then only they make a choice.
There's a good future, right?
Yes.
Great. So thank you so much, Amit, for sparing your time and talking to us. We got some insights into your work and career, and your journey is inspirational.
Thank you. Thank you so much, Dr. Pranav. Thank you.
So if you want to know how we have helped him and how we help the doctors, we have a link below in which there is a webinar link, and you can join the webinar and join the academy. Thank you so much, Amit, once again, for sparing some time and talking to us.
Yes, thank you.